function. This is where we'll be taking questions. Although we do have a specific Q&A section for this program, please do not wait until the Q&A section to put in your questions or any clarifying questions for discussion. Both myself, Rena, and other Nonprofit Center staff will be monitoring the chat, and we'd be happy to answer your questions throughout the program. If you have a question you'd like to ask, but you don't want to ask it to the entire audience, right here, you're going to see it circled in yellow where it says everyone. That's a drop-down option where you can actually select to either ask myself, Rena, Deirdre, Rita, a question directly if you'd like to instead. And I'm going to pass it off to Rena.
Thank you, Isis. Hi, everyone. Thanks for tuning in today for another Nonprofit Center event. And thanks to Rita and Shakaria for joining us. I really appreciate that. So the Nonprofit Center, this is a short list of some of the things that we do to connect, strengthen, and advocate for a strong nonprofit community. And if we switch to the next slide, we're introducing, and you'll see over and over again until it becomes a part of you, and maybe you get a tattoo, the Stronger Nonprofits Framework. This is our theory of change. And what we are hoping that you take from this is that our programming, all that list of things you saw on the slide before, all are going to be integrated into one of these 4 strong elements: strong leadership teams, organizational learning and evaluation, access to capital. And what's important to point out is we don't just mean money. We're talking about human, social, and political capital, all the different ways that you influence and can influence your mission. And then, of course, advocacy and awareness. How strong is your voice? What is the message you're sending? And then how aware are you of the ecosystem messages that are coming in that can influence your business and your mission? And with that, I'm going to ask Shakaria to just tell us a tiny bit about what this important work means to JP Morgan Chase, because they have been strong supporters of capacity building for a long time, which is not, let me tell you, a sexy thing in the funding world, but JP Morgan Chase gets it. So thank you, Shakaria. And don't forget to unmute. Yeah.
Thank you, Rena. Thank you so much for the opportunity to join you all this afternoon. So good afternoon, everyone. As Rena mentioned, I'm very proud to be here today, just basically representing JP Morgan Chase and our corporate responsibility team in support of our partnership with the Nonprofit Center of Northeast Florida and the launch of this report, the 2020 Northeast Florida Nonprofit Compensation and Benefits Report. As Rena mentioned, this is part of our overall efforts to support the building of capacity of nonprofit organizations throughout the country. So very pleased that we're able to learn more about the findings of the survey and report today. As you all know, as nonprofits, you know the very important role that you play in building communities and providing critical services. And we've really seen the provision of those critical services on full display this year. No doubt, you know, this year has been very challenging and has challenged many nonprofits to pivot and adapt in the way in which they serve their communities. You know, while some organizations have been able to transition to a fully digital platform, we know many had to remain open to serve or didn't have the technological infrastructure to do so. So I just want to thank you personally. Thank you for the work that you've been doing throughout this entire pandemic. And I want to thank the Nonprofit Center for being such a resource during this time to help organizations continue to do their work and manage through the pandemic and move toward a recovery. And I just wanted to just speak a few moments towards, I know we're talking about compensation benefits and looking at demographics. This is such a moment in time that we're in. You know, it's an opportunity as we talk about recovery, it's an opportunity to talk about an inclusive recovery and a recovery that's going to create an economy and communities that works for more people. as we've seen during this time, we've seen that as part of addressing this, we also have to look at our institutions. We have to address those structural barriers that have created, particularly as we've seen very deep, profound racial inequalities that have been exacerbated by COVID-19. So here is an opportunity to really look into our organizations and see how do we all collectively move forward for an inclusive recovery. And that opportunity is going to come from being able to strengthen and diversify nonprofit sector leadership, staff, boards, foster meaningful collaboration among nonprofits. But it's also going to take collaboration among nonprofits, local government, and the private sector, all of us working together so that we can develop and advance those solutions that are needed in our communities. So looking forward to hearing more about this, about the findings of the report. And I hope that you find the information today shared alongside with the upcoming trainings. I hope that you find it valuable for your organization and for the communities that you serve. So thank you again for the opportunity to join you today.
Thanks, Shakaria. That was beautifully said. Absolutely. And in fact, I want to mention one of the other investments that JP Morgan Chase has made in the Nonprofit Center is a program we're holding right now that is a way for folks who may not be connected civically or positionally in the culture to find their way onto leadership positions in volunteer leadership positions on boards. And so we have been running the board fellowship program with the support of JP Morgan Chase, and we're really thrilled to have that. I think it's an important link in the diversification of the nonprofit sector, is diversifying that, and in that strong leadership teams, we include boards in that definition. So thanks. So today's agenda is why a compensation and benefits report, the key findings, how can you use this data, and what are the upcoming trainings to advance your approach to compensation, benefits, and equity. Would you just go ahead and skip to the next slide? I think this is the one where we can, let's go back to that tattoo you're getting. The framework really, we can find a place to talk about the compensation benefits report in each one of these separate components of the framework. Under strong leadership teams, we're going to talk about succession planning. We're going to talk about fair compensation. And we're going to look at equity in terms of the composition of leadership and our boards. Under organizational learning, I think that all of us know that without a strong team and without a team that understands its impact, we just can't survive. And that absolutely connects to our human capital, our most important ingredient in our success. And then finally, and Shakaria was talking about this sort of idea that we don't want to go back to normal in our advocacy strategies, in our strategic plans, in our awareness and hyper awareness now of change. We're also seeing all of these inequities, and that a lot of them start right here at home. And I'll share with you, the Nonprofit Center is going through our own deep dive into our diversity, equity, and inclusion practices and culture in our own organization. There's 8 of us, but it's deep and wide, and it takes a lot of very committed and thoughtful and compassionate work to make progress. And one of the first things we're going to do is work on the transparency of our compensation and recruitment and hiring practices. So next slide, please. Isis, I think you're on.
Yes. So I'm going to be getting a poll out to everybody, and you should be seeing it on your screen now. Can I get some thumbs up if folks are seeing it? Okay, awesome. So we're going to take about a minute for folks to respond. And we really want to know Before we dive into kind of the actual findings of the report, what are your top human capital challenges for your organization right now? And you can select as many as you feel are kind of at the top of your mind right now, and kind of what you feel are your biggest focus areas as an organization. So we're going to take probably another 30 seconds for folks to respond.
While folks are responding, Rena, did I hear you say that you're offering a free year of membership to any organization whose CEO gets a tattoo of the framework?
Oh, heck yeah. And it has to be at least 4 inches in diameter.
There.
All right, so I think we've got about half of the folks responding. I know this is an intense question, so we understand if you need some time to really think about it.
And I just want to say I appreciate folks taking time to answer this. If you have something that's not here, please put it in the chat. We do use this information to bring you the content and training and resources and tools that are most responsive. So this really helps us figure out how to take some of those next steps.
Absolutely, and just to remind folks that if there's an other or something else that you'd like to submit, but you don't want to submit it into the general chat, you can send that privately to the Nonprofit Center, and I can share that out with the group. Okay, so I think that we're gotten the majority of folks, so I'm going to go ahead and end this poll. So it looks like it goes across multiple ones, but by 57% of folks, fostering staff health, well-being, and morale is the primary focus, followed closely by improving diversity, equity, inclusion practices. We did get.
Can you, Isis? Can we see that? I can't see it.
Sorry, I thought I'd shared the results.
There we go.
Yeah, awesome. Okay. And then I did get a private message from someone saying that they are struggling with the need to hire new staff, but financial constraints due to COVID are preventing that. Rena, I think you're muted.
Oh yeah, top of mind is absolutely improving diversity, equity, and inclusion practices, it seems like.
So
and then of the, I think, and fostering staff health and well-being and morale. And darned if those things aren't usually connected. All right, thank you, Ice. And I think I'm now turning it over to Deirdre Connor, who actually, she and Rita have been working on this, from the before times. And it's, it's hyper relevant now. And so Deirdre, take it away. Thank you.
Great, thanks so much, Rena. And I'm going to be sharing a few of the key findings of the report with you, but I'm hoping and expecting that Isis and Shakiria and Rena and Rita, that you'll jump in where you have observations to add, and of course, any questions that you have from the chat. And I should probably mention that we will be sending these slides, a recording for today for anyone you want to share it with. And we'll also be sending out the links to the report so that you can access all this data and dig into it for yourself. And if you leave today with more questions than answers, then we've probably done our job, and we look forward to continuing this conversation. So this is really just the first of many conversations that we hope to have about this topic. Before we get started with the results, I just want to bring forth one of the reasons why this is so important is that there is more and more evidence suggesting that the way that organizations can achieve their mission is through a strong, resilient, sustainable workforce, and that human capital is where most of us spend the vast majority of our budget. It's talking about individual change makers. All of these individual change makers within our organizations are really helping us achieve the mission. And so this topic really couldn't be more important when it comes to mission achievement. Before we talk about who's in the survey, I just want to put it into context. We know, you probably hear people say all the time, there's so many nonprofits. And in some ways that may be true, but I want to make sure that everyone knows, if you look at all entities that hold a 501c3, yes, there are over 8,000 in the Northeast Florida region, which includes Duval, Clay, Baker, Nassau, and St. John's. But when you look at organizations that are regularly filing a 990, there's really more like 1,320, and that has to do with budget reasons. It also has to do with organizations that are truly active. And we'll talk a little bit more about how survey participants compare to the overall sector. We also know that the sector employs more than 72,000 individuals in our region. But this is kind of a different survey. We have about 10% of the universe of nonprofits, about 10% of nonprofit employees. We'll talk about why that is in a minute, but we also know that anyone who has at least one employee was eligible to participate in the study, and that the median operating budget of participants in the study was just over $2 million. This is responding, respondents to the survey were talking about what their actual practices are, not necessarily their ideal practices. So these are real things that are really happening. The survey was taking place in, as Rita says, the before times. And so we know that we asked folks to say, here are your practices as of October 1st, to reflect the reality of many budget cycles. And we know that for most folks, fiscal 2020 for your budget probably got thrown into a bit of disarray by the pandemic. So we're going to talk about the impact of the COVID-19 pandemic and the recession on the way that you might want to use some of these results and what we may see in the future before this is over. So if you have questions around that, please collect them too, because we're actively thinking about that and how we follow up on some of these things. A few other things that are covered in the report. Any place where we had job titles where there were 5 or more respondents could be counted. Of course, there are some jobs that may be truly unique to an organization. They would not be included in that 93. We look at profiles of a wide variety of different positions in terms of race and ethnicity, gender, pay, and so on. For the first time this year, we asked about board member demographics so we can have a better sense of the leadership teams that are part of our those high performing leadership teams. And of course, asking about HR policies, compensation and benefit practices, volunteer use, and a few other things. So pretty comprehensive. And I just want to give a special thank you to the 101 organizations that participated in the survey. It is a heavy lift to participate, and they have seen this information first by participating. So thank you to those organizations, because this information is so crucial to the sector. So hopefully you're finding not only a benefit to your organization, but also feeling good knowing that you have done something positive for the sector overall. Survey participants by field or mission area. We see that this is very representative of our overall sector, except in a couple of key areas. We do typically not include hospitals, nonprofit hospitals, and universities in this survey for reasons that have to do with how different they are in terms of business model and size than some of the other nonprofits. And Rita, I don't know if you want to add anything to that, or how
Yeah,
you another.
I would just say quickly that hospitals and universities often have their own sort of industry specific surveys that are designed for the kinds of jobs that they have, and for that reason often would be better served for many of their jobs by that type of survey. So there seems like a bit of a mismatch when looking at this kind of survey and the organizations in the broader local community that it's meant to serve.
Great, thank you. When you look at the sector overall, and this is the local Northeast Florida nonprofit sector, and you look at that universe of about 1,300 organizations, the vast majority, that's the area in green, have a budget size of under 500,000. And when we look at those smaller organizations, they may have a great impact in the community, but they may be all volunteer. So it's worth noting that for the purposes of this survey, we saw a different breakdown of organization sizes, because these are organizations that have at least one employee. So it's not to say that small budget organizations don't have a large impact in the community, but they impact the community potentially in different ways. So looking at the types of organizations represented in the survey, we see organizations that have budget sizes under 500,000, representing a much smaller part of the universe, because we require at least one unpaid employee to participate. And looking at that breakdown a different way, these are the participants in terms of how many full-time equivalent employees they had on staff. So the largest number, 35, had between 1 and 10 FTEs, and we know that that is very common for our area to have a median of about 9 employees. And then we had 25 in that 11 to 25 FTEs. And then I had not enough room on this slide for all the little people that would go into this. So 15 nonprofits did have more than 76 employees. We get a lot of curiosity around what number of employees are typically at an organization of different budget sizes. So here we have a breakdown of the average number of FTEs at organizations that fell within each of these budget size groupings. So that's a little bit about the universe of nonprofit organizations that participated in the survey. I'm going to take a quick break here just to see, Isis, is there any questions in the chat about that, or anyone who wants to add anything about who participated in the survey?
Not yet at this time, we're good.
Okay, so let's talk about some of the key findings of the report. The first one is really that sector leadership, so we're talking about board members, CEOs, and also some C-suite, is overwhelmingly white. We know that this has not changed since our 2016 report. And we also know that this is a challenge that the nonprofit sector all over the country is talking about and has talked about for a long time, but hasn't made a lot of headway. We've known that nonprofits need to build more diverse and equitable workplaces that are more representative of the community. And how is it that we hire, promote, and keep Black, Indigenous, and people of color on the job? We also know that there are cases in the country where people have made some progress. So we do know that this isn't an intractable problem. There are solutions to this. And Isis, I don't know if you have a chance to put this in the chat, but there's a great study from the National Building Movement Project. They recently re-released their Race to Lead report. And it shows that nearly half of BIPOC workers say that their race curbs their career advancement. And about 2/3 of white participants indicating that the color of their skin gives them an advantage. So we know that this is a big problem. We also know that having a DEI focused plan for how you hire, promote, compensate your employees can help address some of these inequities. Digging a little bit deeper into that data, this is a look at race ethnicity of CEOs or executive directors and board members in our survey of the local nonprofit sector. So we see that board members are maybe slightly more representative of the region as a whole, but not by much. And we also know that we don't have a lot of representation from Indigenous communities. This is something that is very similar to what is seen across the country. Looking deeper into staff, I know this is a small chart, but I wanted to make sure everything was included. This looks at demographic breakdown of all employees of organizations that participated in the survey. And we do see that there are some differences in terms of budget size, but that overall staff demographics tend to be more representative of our wider community. Another finding is not a surprise to probably anyone on this call. Sector staff are 78% female. They are also 67% of all CEOs and executive directors in the sample. Yet we also know that the majority of board members are male, about 54%, and that male CEOs make more than female CEOs. So digging into that a little bit, that top chart is looking at salary data for nonprofit CEOs or executive directors in the sample. You can see the gender breakdown of board members and then also of staff overall. And this is like a really important point to mention. this survey was of a single point of contact at an organization. So this isn't self-reported data on gender identity. And we know that not all organizations offer employees the opportunity to self-identify or the opportunity to identify as a gender outside the binary of male or female. So most likely this is an undercount of folks who are identifying that they are not gender binary or have another gender identity that is self-identified. So I want to mention that as an important part of this study. And then finally, around leadership teams, unchanged in our data is that the average CEO is 56 years old and has been in that role for over 8 years. But we also know that 28% of the organizations in this study expect a transition in that position in the next 3 years. And we know that 1 in 8 organizations that expect a transition don't have a non-emergency succession plan. So there's still work to do in that area. And we'll talk a little bit more about that soon. Another huge finding from the report is looking at pay equity across the sector. And it is thrown into sharp relief this election season in Florida because we do have a ballot initiative on the minimum wage that would raise minimum wage to $15 an hour. Rita looked at our data and found that 39% of the jobs in those 93 different job titles pay less than $15 an hour from the standpoint of a median. So median meaning that half is more and half is less. So what does it look like for our sector to address some of these systemic inequities, some of which we are actually working from a mission standpoint to combat? We know that families who are not living in poverty are very much being pressured pre-pandemic by the increasing cost of living and stagnant wages. And we also know from the United Way's ALICE research, and that's an acronym that stands for Asset Limited, Income Constrained, and Employed, that households with income above the federal poverty level, but below the basic cost of living, that's a really significant part of not only our community, but also of employees in the nonprofit sector. So the ALICE threshold for a basic survival budget in Duval County for a family of 2 adults and 2 young children requires about $35 per hour or $17.50 for 2 adults working full-time 40 hours a week. What jobs pay less than $15 per hour in our sector? They include preschool teachers, receptionists, warehouse workers, custodians, data entry operators, and on and on. They're workers that have been considered, particularly in light of COVID-19, essential. And as Shakaria talked about, nonprofits have really never been more essential. So from providing some essential services, such as access to food or housing or healthcare, to serving youth and children, nonprofits in our area have kept their physical and virtual doors open, but often those frontline staff members delivering those essential services are among the lowest paid at any organization. This is just a quick comparison of some of the annualized salaries of different positions. These are the median in the cases of the blue bars. And then this, the gray bars, this is ALICE survival budget for a single person. This is an ALICE survival budget for a family of 4. This is just for one person. So this is really half of what is needed. And then this bar right here, this is the proposed minimum wage of $15 an hour on an annualized basis. Kind of along with that, we see that the median base pay for all non-executive employees is $35,000. That means half of jobs pay more and half of jobs pay less. And this amount has not gone up since our last report in 2016. So when you adjust that for inflation, it actually amounts to a $3,000 per year decrease. This isn't unique to our sector in any way. Wage stagnation and increasing cost of living was a big problem that our entire nation has been experiencing pre-COVID-19. And decades of compensation research across sectors shows that some of these perceived inequalities in compensation can really lead to high turnover and dissatisfaction among employees, which goes straight to the mission question from before. So it really prompts questions like, are racially diverse employees represented equitably at all levels of the organization? How are they promoted? Which types of positions are staffed primarily by workers that identify as Black, Indigenous, or people of color, and by white workers? and which contracts or funding agreements have locked certain job roles into low base wages, and how does that affect the advocacy strategy for all of us? I'm taking a breath here, Isis, to see if there are any questions in the chat.
No questions, just some good conversation, but I'll let you know if any come up.
So finally, in the area of wages, in the before times, 84% of organizations in the survey told us that they were expecting salary increase budgets in their current fiscal year, with an average increase budget of 2.6%. We can only imagine how the pandemic and recession will impact those future plans. We'll talk a little bit about that when we get to the impact of COVID-19. And then finally, the bucket of key findings around practices and benefits. These are things outside of compensation, but really, really important to attracting and retaining a diverse and high quality workforce for your organization. For the first time this year, we asked about non-discrimination policies that organizations have. Most have them, which is great. 71% have policies that include gender identity and expression, and 81% have a policy that covers sexual orientation. So we know that organizations are still kind of catching up to the local landscape, where our human rights ordinance in Duval County, at least, now covers those two items. We've seen about 82% of organizations offer some type of medical insurance coverage. It's very similar from what we've seen before. And that about just over half, for the first time, just over half have a completed and updated emergency succession plan in place for their CEO position. And we were happy because we've done this type of survey question many, many times in many different formats over the last few years. And this is the first time that we've seen that bump up above half. So we're seeing some great progress in that, but we do know that still there are many organizations that don't have something in place and may be expecting a transition in that position. And then finally, paid time off outside of holidays, sick days, personal days, et cetera. This is looking at organizations that are providing paid time off for these various different types of life events: bereavement, jury service, a few hours each month to put toward volunteering, which is wonderful. We have seen some positive progress in many of these areas from 2016 overall. It's important to note that the survey participants this year are not the exact same universe as they were in 2016, as we've had organizations leave the landscape and be added to the landscape. But we do see overall trends that suggest that more organizations are moving toward offering childbirth or adoption leave for primary caregivers and secondary caregivers, as well as for military service and volunteer service. Okay. Taking a pause for anything that folks want to add or questions from the chat.
We're good on the chat still for now.
Okay. So let's talk a little bit about the impact of COVID-19 pandemic, because the survey, as we mentioned, was administered in just before the pandemic hit. And we know that that has radically changed the landscape for so many organizations. This is from a survey we did that was as of May and published in July, looking at the Northeast Florida nonprofit sector and how COVID-19 has affected organizations, seeing equal proportions losing revenue or experiencing increased demand for services. The vast majority of organizations successfully applying for the Paycheck Protection Program or other types of relief funding. A quarter having to cut hours or lay off staff, and more than half losing revenue due to canceled fundraisers, which we know has extended throughout 2020. Also have seen that a third reported difficulty operating in a virtual environment. And we do plan to re-administer the survey so we can see what is or isn't changing as of this fall. So stay tuned for that. And we'll also be re-asking some of the questions that were on this compensation and benefit survey so we can have an idea of what may change or not change, and share that back out with you. Rita, I don't know if you want to share anything else about how folks may want to look at salary increases for the next 12 months, and any observations you have from other communities from the last recession that we had.
Yeah, this is really interesting. I'm in Northern California, and I do a similar survey for the Northern California nonprofit community every year. And I did a follow-up this year to ask some of these kinds of questions, because like your report, ours annual report was, the information was submitted right before the pandemic hit. So I saw some, some similar kinds of numbers to the same questions. And another thing that we asked was whether or not organizations, whatever their planned salary increases were, whether those plans were impacted by the pandemic. And about half of organizations said that yes, whatever they thought they were going to be doing in the near future about salary increases, those plans were being reconsidered, either with some delays in salary increases, hoping to reinstate, or smaller increases than they had anticipated. So that's pretty common. I think it's interesting here that you have certainly some organizations with lost revenue because of reduced demand for services, and then you have kind of a similar number with an increased demand for services. And we find that here too, depending on what their services are. Emergency housing services and food bank services, and some really crucial sort of survival related services, we're certainly seeing an increase. And similar issues with concern for essential workers and what can be done for essential workers who are not able to just stay at home and protect themselves and their families in that way. So I guess it's not surprising that we see these kinds of effects probably around the country right now, certainly in Northern California. The other thing that I would want to say, I've been looking at these kinds of numbers for a long time, and certainly was doing this kind of work when we had the recession of around 2008. And at that time, when I would look at things from one year to the next, one of the things that we look at that was affected immediately, or I shouldn't say immediately, affected relatively quickly, was this question of salary increases. So up to that point, around 2006, even 2007, I guess the recession technically started sometime in 2007, we were seeing the great majority, 90% of nonprofit survey participants with some sort of overall salary increase budget. And when that recession hit, that number really dropped the next year, and took really quite a long time to get back to the level of something approaching 90%. I mean, maybe around 10 years, and it was inching up. It certainly improved as that recession lifted, but it was kind of a slow climb. But one thing that I would like to say, I wondered at that time whether I would see actual reductions in pay overall in the survey data. It, we've asked organizations whether they're planning to reduce pay or whether they have reduced pay for any of their employees, and some of them have. But when we look at compiled survey data based on a broader sample of organizations, I didn't see pay levels dropping from year to year. What I did see at that time, at least, was a slowdown in the rate of increase, or some sort of stagnation in pay levels for more jobs than I typically would see that for. So it wasn't that we published a survey and then all of a sudden everyone's paid less than what those numbers indicate. That didn't happen. But if we wanted to take that data and say, age it, in other words, try to take a guess at where those levels would be a year later, for example, typically we might age by about 3%, because that was what we had been seeing as overall salary increases. And with that recession, it didn't really make sense to try to age it by 3% because the rate of increase in pay was just not as high as it had been. So that's something that I wouldn't be surprised if we see now. And one recession is not necessarily analogous to another. There are real differences about the situation we're in now. The recession around 2008 had its basis in financial markets and financial instruments. And certainly, this recession is a public health, the public health crisis at the basis. That I think there are some people who are hopeful that that because it wasn't based in financial issues, that a recovery may be quicker when it comes than the recovery of 12 years ago. I certainly hope so, but I wouldn't want to predict that. It just seems that there's so many factors involved in how that are unknown at this point in terms of how we're going to exactly make our way out of the public health crisis that is across the country right now. So we did see, I've just made some notes here in the recession, the prior big recession. We certainly saw some pay reductions, but as I said, not enough to cause the survey data to be reduced from year to year. We saw some salary freezes, organizations that just said, we're not giving any increases for some period of time, and that's happening now. We certainly saw hiring freezes. One thing we saw that I thought was interesting was for organizations that weren't giving increases, but wanted to reward employees, whether some employees or all employees, we saw more year-end or annual bonuses given so that employees had the additional money, or at least some of it, that they perhaps would have gotten in an increase, but the organization then hadn't raised base pay in a way that essentially felt like a commitment into the future. So that was a strategy that we saw that I think is not so unusual. But we did see pay levels in many cases rising somewhat, but not at the rate that that we would have expected to see without recession conditions.
Great.
I hope that's helpful.
Thank you so much, Rita. And Rena, I don't know if you wanted to add anything about where the Nonprofit Center is going in terms of the repositioning working group and the next steps for that.
Sure, but before I do that, I actually have been privately chatting Lorianne Whittington because I know Lorianne's work at Pine Castle. When she came in, she immediately did a compensation review. I thought it was a really fascinating approach to assessing the organization's strength. And I was also considering the work that they do supporting differently abled adults as frontline workers delivering essential services during COVID. So Lorianne, I'm going to put you on the spot, and would you just give us a quick overview of some of the work that you did and what the impact was over time?
Can you hear me?
Yeah.
Great. Well, thanks, Rena, for the opportunity. We did a very comprehensive salary study based on the last nonprofit report that was released on 2016. Of course, I came to Pine Castle in late 2017, so the data was just a little bit off from super current, but it was very helpful because the organization had not given raises since the 2008 recession, and it was now 2017. So wages at all levels had been frozen at those levels, just as Rita just talked about, the post 2008 impacts of what had happened. And so, but by 2017, the economy was going strongly, everything was going well. And what I really discovered when I started to dig into these wage issues is many of our hourly workers were still only making around $9 an hour, and they care for our most vulnerable citizens that are adults with disabilities. And so, but the organization at the same time was giving end of year fiscal bonuses if the fiscal year had gone well, and they were giving Christmas bonuses. And so really, we just worked for about 6 months with your last report. And we did a comprehensive market study looking at every single position and matching every single position to where they should be in the market based on averages and tenure. We also worked with an HR consultant to kind of create a tenure grid, because what we were seeing is as we started to raise minimum wages, there was wage compression with staff that had been here maybe 20 years doing the same job, and they were still making the same, and somebody new was getting raised, and so it was crunching their salary. So we put a grid overlay in place for tenure adjustments. At 3 years would be the 25th percentile, 8 years would be the 50th percentile, 15 years, the 75th, and then they would max out at 25 years, because we have a lot of employees that have been here more than 20 years. So really, when we looked at all that together, we looked at each market study position, we looked at the tenure grades and everything. It amounted to, we needed to make a $465,000 adjustment on a $6 million budget. So that's a pretty big dent in a $6 million budget. It wasn't a drop in the bucket. And to our board's credit, with redeploying the end of the year fiscal bonuses and the Christmas bonuses, that gave us about $200,000 a year towards that $465,000. But we had to adjust the culture with the employees and say, it's not going to be an end of the year bonus. It's not going to be a Christmas bonus, but we're going to adjust real wages over time. And the board voted to do it all at once. And so we did it all at once. We adjusted our budget, and we were able to absorb that over the next fiscal year. So that level set everything at that 2016 level. So now obviously we're looking at and we didn't get that done until 2018. But now, of course, we're going to be looking again at the 2020 study, adjusting all of our benchmarks accordingly. And then we're going to have to take a look and see, obviously now post-pandemic, how are we going to get there to make sure that we keep our employees at the most current levels, from the hourly worker all the way up to our senior staff. And so our minimum wage is now at $10.58, which is still not great, but it's up from $9. Many of our residential staff are making 11 or 12. So we're on the right pathway, but it's something that we're committed to constantly looking at, adjusting it every time that you guys do a survey. The work that you've done here is super helpful for us to actually make a real difference. And when we did that $465,000 adjustment, every single employee in the agency got an adjustment, but they were different. They were based on where they were to market. It had to do with their tenure and how far they were off of our market rates. For example, our group home managers were very far off. They got significant increases, but we were committed to staying to those market numbers. So that's just a little bit about how we use the study, how it helped us, and how it helped us impact minimum wage, as well as keep up with post-2008 decreases and wage freezes that needed to be corrected. And at least we got that far, and we'll see if we can get it up to the 2020 level. So I hope that helped.
Yeah,
we're looking
that's
forward.
awesome. That's awesome. And I was also thinking about, I was talking to Beth at Basca about their group home managers and how difficult managing during the pandemic has been. And, so, I'm hoping that you had a positive impact in terms of, being able to keep valuable employees on because they saw the investment you were making.
Well, we did. We really didn't have any turnover during the pandemic. And our group home managers stayed intact. Our group home staff stayed intact. And knock on wood, we've had no positive COVID diagnosis of our participants in our group homes at all. So, I think the wage adjustments really helped a lot with morale and the tenure and it dropped turnover, obviously, because they saw that we were making a commitment to their future and their salary.
Right. And there was a transparent structure so that they could understand where they fit. Yeah. Yeah. Mm-hmm. That's awesome. Thank you, Lorianne.
Sure.
Yeah.
That's an incredible story. And Lorianne, just thank you for sharing all of that. We do have a few questions that have come in, but Rena, I just didn't want to skip over the repositioning, or if you want to put it in the chat, if people want to be involved in the next generation of that report, we'll send out the link to it, and also some ways that you can get involved, because we need leaders like you involved in the process. We did have a couple of questions that came in. One about Candid, which is which many of you may know went through a branding, but they are a national organization that looks at the nonprofit sector. They have a recently released compensation survey that includes MSA data. We could do a couple of comparisons, but they do include those eds and meds, the higher education institutions and hospitals. But we can send out the link and you can take a look. Another question that came in, it would be interesting to know if organizations have set wage or salary ranges as opposed to not having established the same. And Rita, I'll toss that to you, because I think I remember that in the report somewhere.
I think it's in the report, and if you want to give me a minute, I'll see if I can find it.
Sure thing. Anybody who hasn't who's chatted to you, Isis, or who wants to just unmute themselves and ask a question or share an experience?
Yeah, I did have a private question come in around market wage and what's comparable, what the work is worth in terms of mission. Mentioning that Lorianne says that their lowest paid person was closest to the mission. How do we address the market worth versus the mission worth? I think it's a really interesting question.
That's awesome.
I did find something about salary grades. Oh,
Rita, I think you're muted.
okay. Can you hear me now?
Yes.
Okay, good. Okay, so among the survey participants, just under half, 43% indicated that their organizations do have salary grades or ranges. And among that group, 37% reported that they had adjusted their ranges during the past 12 months. And the median adjustment was 3%, adjusting it all upward 3%. Another third, 33%, said that they plan to adjust their ranges during the next 12 months, also with a median adjustment of 3%. So close to half of the organizations, I don't have a breakout here, but typically it tends to be the larger organizations that are more likely to have salary grades and ranges.
And Rita, I don't know if you had any comments about the market. I love that question, Isis, that someone chatted to you about the market value versus the mission value.
Yeah,
because we do see
that's something that certainly comes up when I talk to people about using the salary report information. There are times when someone will say to me, well, we see that, so for example, here in Northern California, I work with a group of organizations in the housing development, nonprofit housing development field. And along with that, they have some social services. Typically, they do community organizing, community development work. And I've had organizations say to me, well, we see that the community organizers in the survey make X, whatever. But we consider them to be really essential and basic to our organization's mission. So we have, there's some feeling on the part of some people in the organization that they should be paid more. And that's really legitimate. Organizations have their own, as you say, missions, and there may be very good reasons for really prioritizing the work of certain employees that are, when that work is seen to be really essential to the mission. And sometimes it isn't, given salary survey information, it isn't necessarily valued monetarily that way in the broader community, or not to the extent that people at a particular organization wish it were, and they can lead the market. And that's just fine. That's as long as they're doing it in a way that they've decided this is important to them and that's what they want to do, and that within the organization there's agreement about that. So you know, it seems to me that it gets to the question of internal equity when organizations consider external market data, which is what published salary data is. External market data is crucial, but internal equity assessments are important as well. And so, you know, you can look at survey data. We try to write job descriptions that are recognizable, that are so that people can match their jobs readily for the most part, but jobs are somewhat different at each organization. And I always suggest that people consider the jobs at their organization, how those jobs relate to each other, how they fit in the organization in terms of levels of responsibility, and the sort of basic importance to the mission of an organization can be part of that consideration as well.
Thank you so much, Rita. That's a great note to wrap up on. I do want to say thank you to you for being here, and I want to hand it over to Isis now to talk about how you can take all this avalanche of information and put it to use in your organization. We're not just throwing you to the wind there. We have opportunities for you to take some next steps.
Absolutely. And I know that we're at our time, so I'm going to try and be succinct. But really, as you just said, Deirdre, you know, making sure that we're creating space for continued conversations, especially really glad to hear that the things that folks identified as being their problem areas and focus areas are the things that we have kind of scheduled to have continued conversation around. So the three topics that we're looking, the three topics that we're looking to have kind of not just continued conversation, but also connect you to additional resources and expertise. But also kind of elevate the experts within our own sector. Really hearing Lorianne, your experience in creating that compensation plan in that process, definitely elevating stories like that. So we're going to be doing developing a compensation plan on November 13th, promoting DEI through better compensation on Tuesday, December 8th, and then CEO performance evaluation on Monday, January 11th. And these are free and open to all nonprofit organizations. Thanks to JP Morgan Chase, and you can register for those on our website.
Thanks so much, Isis. So next steps, if you are a member of the Nonprofit Center, we'll be sending you instructions on how you can log into the member portal and download the full report today. If you're not a member, we can help you join, or you can, of course, purchase the report. We'll send information about how to do that. Please register for one of those upcoming trainings. Feel free to send these slides and recordings to anyone within your organization. And if you would like us to present this information in a more abbreviated way to your board, please let us know, and we are happy to do so. And with that, I'll just leave you with a list of some other upcoming events. It was wonderful to see everyone virtually, and if you have questions that come up after this, please don't hesitate to reach out, and we will get you connected to that information. Thanks everyone for being here today.